What's going on, guys? This is Greg with Movement Driven Performance Physiotherapy. Today we're going to talk about the hip flexor stretch. All right, so the hip flexor, or the main hip flexor called the psoas, is attached. Um, it starts in my lumbar spine, actually. Okay, so if you can imagine, my spine's way back here, and then at the front of my spine, behind all these organs and all this other stuff, I got the muscle, and it's traveling to the front of my hip. Okay, so what you want to make sure with this is that you're not arching your back as you lean forward. So you've probably all seen this kneeling hip flexor stretch. Like, I can get all the way here, but I'm feeling a stretch, but I'm not stretching the main muscle that's attaching to the lumbar spine. That's kind of causing all of those issues. When the psoas, we all think of it as tight. Really, it's usually weak, but we do need to stretch it to kind of just relax it and reset it a little bit. Okay, so that's why we're doing this now. But the psoas muscle, it comes from the hip, it attaches to the lumbar spine. So if it's kind of in spasm, it's going to be kind of pulling on my spine and kind of launching me into this anterior pelvic tilt, further compressing certain parts of the joints in my lumbar spine and my low back, and that's just not good news. So what I want you to do is kneel down. Okay, the first step here is to do a posterior pelvic tilt. All right, so we've kind of already talked about that in other videos. Check out the pelvic tilt video if you haven't seen it. But what I want to do is tuck my butt underneath and squeeze it, pull my belt buckle towards my chest, and tense my abs. Now that position, you hold that. Okay, hold that throughout the duration of this exercise. Now what I'm going to do is, as I squeeze this muscle, squeeze the glute, I'm driving my body forward as a unit. Okay, what I don't want is I don't want my hips to go way forward and my shoulders stay back, because now I'm arching. When I arch, that psoas muscle is now shortened because I went into that arch position. I shortened it. So I'm trying to stretch it, right? Let's stretch it. So maintain that tilt, keep that back flat, and have my hips and my shoulders glide together as a unit. And you should only be able to go a few inches. Like, I only went 2 inches. I'm a little tight there today. So I went a couple inches. I feel the stretch deep in here. If you feel like you're going way further, then you lost that tilt. Come back, reset, tilt, squeeze, tense, and then shift. And hold. 30 to 45 seconds, guys. Hold it. Keep squeezing. You can even kind of relax the glute and then squeeze it again, so you can kind of feel the difference between when you're fully at that end range of that muscle stretch or not. All right, so hold that. Add this one in your routine.